Special thank you to Carolyn for doing this for us today. Um, she's one of our top-notch counselors, and we really appreciate all the hours that she donates to us. Okay, so I've got some questions for you, Carolyn. First of
Okay.
all, tell us, how long have you been a ship counselor?
I've been a ship counselor 4 to 5 years.
4 to 5 years?
Yeah.
So, do you have, in those 4 to 5 years, I'm sure you've met a lot of people that have a lot of questions.
Yes,
Do
and
you
they're all
have
good.
a special memory that stands out of one of your clients that you helped?
I do. I love this not story, a memory. A couple of years back, I had a young gentleman call me, and he's on Medicare. He had a very severe disability. He's probably only in his 30s. And he had trouble. He said, "I can't afford my prescription," he said, and he was on a lot of prescriptions. So he came in and sat there and talked to him and listened to his story. And it was the horror story we've all heard, but it was, I mean, he was experiencing it. He said, "Every month I have to decide, am I buying my medicine or am I paying my rent?" I mean, it literally came down to that for this man. And he went from his, which is the Healthy Indiana plan, to Medicare. So he had good insurance coverage through HIP. But once he got to Medicare, he didn't get the appropriate Medicare counseling as far as what options are available. So I sat down there with him. We talked about his income and his resources, and it appeared that he would be eligible for a Medicare savings program. Of course, this young man had no idea what I was talking about. And where you always hear the adage, "It's too good to be true." That was kind of like I could see that was what was going on in his mind. So I took the time. I explained to it what it would do. It would cover his Part B premium. It would so his check would go up every month by 144. He wouldn't have any copays at the doctor, no premiums, no deductibles, and he would get them at a much better rate. And he's shaking his head. I'm like, if you want help, I'll help you fill out the application. So we did. We filled it out right there. I got what documents I needed from him, like his Medicare card and everything he had on him. So I went ahead and faxed it up to the process, the FSSA process. At the end of the conversation, he was starting to get more excited, like if this is really true, this would be great. And told him what the application process would be and what to expect. He would get letters, if they needed to see other documents. If it was confusing, he should call me and make sure he had my phone number. And I said, then I can help you figure out what they want and let him know it'll be 45 days or so before you get a decision. But I said, call me when that happens, because there may be some other options for the zero-based prescription drug plan you want to go with. So I didn't, and by the time he was leaving, he was really starting to believe it and think it about how this would help him. And it was kind of like a kid at Christmas, I didn't hear anything for about 2 months. Then he called back in, made an appointment. He came in, he said, "I got this letter, I got it." And we talked about how this would change and what to do when he goes to the doctor, show him his card. And then we changed his insurance to a zero-based plan so he wouldn't have a premium for that either. So just a little bit of information, which he didn't have, and assisting him with this process just made him better. It made a big difference in this young man's life. So
Right.
I just loved it, even to think about that. It was really a good time.
And I'll bet you've helped many clients apply for those programs that help them save money and actually be able to get the health care that they need and not have to make that horrible choice of paying rent or
Yeah.
getting my medicines and going to the doctor.
Yeah.
So I like that story also because it shows that we work as ship counselors, we work with folks of all ages.
Mm-hmm.
Yeah, most of our folks are over 65 years old, but Medicare does serve people under 65 who have disabilities. And so we're really able to connect with people of all ages,
Absolutely.
like you did with that young man. Um, so thanks for sharing that story. and you really made a difference in his life. I mean, huge, huge difference. So
Yeah, I like helping people, especially save money.